Welcome to WakeGovTV. I'm Eric Curry. We have several topics lined up for you today, but first, the number of individuals and families in need of affordable housing in Wake County continues to increase, but the supply of affordable housing to meet the need does not. The Supportive Housing Program offers a wide range of support services to families and individuals who have reached an impasse in maintaining or assessing safe, decent, affordable housing. Anne Marie Majorano is joining us now to talk about the county's housing program. Thanks for joining us, Anne Marie.
Thank you, Eric. I'm glad to be here.
First, let's start talking about the goals of the housing program and what do you and your staff do to make that happen?
Sure. Well, the goal of Wake County's housing program is to provide as many varied housing opportunities for low-income families in Wake County. We focus on families that earn less than $30,000 a year as our highest priorities. We found that this market segment is basically priced out of mainstream housing in Wake County, and they have a difficult time affording their rent and other basic needs that they need to sustain their families.
There are some specific groups that you all provide priority services to. Can you tell us about those groups?
We focus on people who are disabled, veterans, homeless individuals and families, and we also do offer services and housing supports to the working poor.
And what things do you do for the people in these groups, and what kind of services that are provided?
One of the primary programs we have is a gap financing program for affordable housing development, and that actually gets new units of housing on the ground or makes existing units affordable to lower income families. We also provide a health and safety repair program for folks who are elderly and disabled to help them stay in their housing and help them from prematurely having to go into nursing homes or assisted living facilities. We provide rental assistance vouchers to homeless people who are also disabled, and typically that disability is a severe and persistent mental illness, and without this rental assistance they would not have a housing option in Wake County. We provide case management and support services either directly through staff or by contracts with nonprofit agencies. We have an employment initiative. We help people at South Wilmington Street Center with job training programs so that they have the skills that they need to leave the center and maintain employment, which will help them pay rent. We offer limited short-term rental assistance, and we do this through our nonprofit agencies. We do it with contracts. Our nonprofit agencies actually provide the service and the assistance. We provide a general housing information session every day at the Human Services Building on Swinburne Street. And we have a ready-to-rent program that teaches people how to be good tenants.
Along with those services that are provided, your office also takes part in some community development projects. Can you talk a little bit about how that works?
Correct. So housing alone doesn't necessarily provide a safe and stable community. So we work with partner towns with this initiative. We'll help install sidewalks, curb and gutter, make street improvements, drainage improvements, and this paired with the housing makes the neighborhood healthy.
Well, Anne Marie, thank you for joining us and sharing with the viewers about all that's being done to make sure that everyone has access to safe and affordable housing.
Pleasure. Thank you for having me.
Thank you. When we return, we'll talk about the progress going on with the construction of the new Wake County Justice Center and include important information for our viewers about location changes that will be occurring this summer for several county agencies and programs.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Don't look at me. Your hair's a bit frizzy today. Oh, you should pick that up.
Every day, kids witness bullying.
Poor you.
They want to help, but don't know how. Teach your kids how to be more than a bystander. Visit stopbullying.gov.
In July of this year, the new Wake County Justice Center will officially open. The 577,000 square foot, 11-story facility will consist of 18 new courtrooms with the capacity of adding 4 additional courtrooms in the future. The building will also provide public meeting space for the Board of Commissioners and administrative space for the county manager, county attorney, finance and budget operations, register of deeds, revenue assessor, and various other support spaces. WakeGovTV recently toured the facility.
The county has a long-term criminal justice master plan, and one of the key reasons we're building this Justice Center is to accommodate both the civil and family court along with the criminal court. The criminal court moves into the Justice Center, and so that need having been met also allows the civil and family court to grow into the existing courthouse, and so we have a long-term plan for that we'll be executing over the next year, right after we move into the Wake County Justice Center.
The first decision that was made was to keep it downtown. We wanted to cross the street from the existing courthouse just to facilitate access back and forth between the two. We wanted the building to be durable, long-lasting. You'll see we have lots of stone, terrazzo floors, stainless steel materials. All those materials are very durable and they will last a generation.
The building has some very nice energy management features to them, and those things are coming together now. There are lighting controls and all sorts of heating and air controls that will help keep our energy bills down. It's designed around the public. So aside from the normal public counters that you can come and ask questions, there'll be a series of monitors that are located on both the east and the Nash Square entry of the building that will scroll the court calendar.
We also had a couple other key vision statements for the building. We wanted to have a lot of natural light in the building so that it felt sort of open, inviting, and friendly when you come into the building. We wanted it to be sort of a stately building that let you know that there was something special that goes on in that building. There will be about a 4-week period where the various user groups in the building, be it the courts, register of deeds, county commissioners, county administration, public defender, district attorney, they will all move in over a scheduled 30-day time period.
The first public opening in the Justice Center will be on June the 12th, and that will be the Register of Deeds and the Revenue Collector. Court will open on July the 2nd, and that is a Tuesday after the public ribbon cutting on July the 1st of 2013. The building is designed for the next 80 to 100 years for the Wake County court system, and we're very proud of this and what it means to our community.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. It's like, hello? That's where you put it last time. You were the worst at hide and go seek.
Packers, Vikings,
Red State, Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country.
United.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
April is National Child Abuse Prevention Month, a time to recognize that everyone can play a part and important role in making sure the social and emotional well-being of children and families in communities are taken care of. With me is Denise Billman and Kristen Duranja to talk to us about the things that parents, communities, and caregivers all can do to make this situation preventable. Thank you for being here. First, Kristen, can you tell us a little bit about Safe Child, the organization you're connected with, and why this program is so important in hopefully preventing child abuse?
Safe Child is Wake County's only child abuse prevention agency, and we've been providing services to children and families for about 20 years here in Wake County. And the name of our organization is actually an acronym. It stands for Stop Abuse for Every Child, and that is something that we believe wholeheartedly in every aspect of our mission. And we provide 4 different types of programs in a way to help strengthen families and support caregivers so children can be raised in environments free from abuse and neglect.
And Denise, your organization, while it's not directly connected to Safe Child, it really focuses on coming in after a situation. Can you explain a little bit about your role and your staff's role in becoming a part of this whole program?
I'm with the county, and it's Child Protective Services, and what we do is get reports from the public when they have concerns of suspicion of child abuse or neglect. What we try to do with people is look at safety, permanency, and well-being. We hook families up with services like Safe Child after we are involved with them for any further abuse or neglect not to occur. But obviously, when we're involved, someone believes that this child is at risk.
Are there any commonalities in the cases that you all have to respond to? Are there some factors there that really can be worked on through assistance with organizations like Safe Child?
Certainly. We believe that most of the families that get referred to Child Protective Services is because of stressors in their lives, lack of education, or other resources that they don't have, or they don't have the knowledge of, or they don't know where to look for them. And so what we try to do is hook them up with community agencies that's close to them, that they can provide that service, receive that service for them and their children to be successful in being parents.
Now, we're talking about child abuse and neglect. I learned that there are 6 protective factors that are used, and let me go real quickly. Nurturing and attachment, knowledge of parenting and child development, parental resilience, social connections, concrete supports for parents, and social and emotional competence of children. Kristen, what are these, and how is this a part of really improving one's situation?
We know through research and through experience when those protective factors aren't in place in families, they are at risk, and therefore so are their children's welfare. And so, for example, one of the things that you talked about would be knowledge of child development. And so at Safe Child, we try to help parents learn and understand and appreciate what children can do at certain ages and stages of their development, and to have appropriate and realistic expectations for their children. You also talked about social isolation is what we deal with a lot. When parents are isolated, they don't have support, either be from family or friends, they don't have the resources and in place to be able to help them with one of the most challenging or the most challenging jobs in their lifetime. And so it's important at Safe Child that we help get families plugged into resources, to avenues for support and information so they don't feel so alone in the journey of being a parent. And I mentioned earlier we have 4 different types of programs. One is our group-based programs, and those are parenting classes that anyone from Wake County can take advantage of. And then we also have our home-based programs where we partner with moms who have their first-time baby and mentor that mom through the baby's first year of life. And so it may be that a first-time mom, after completing that Welcome Baby program with us, then would really benefit from moving into one of our parenting classes, continuing to learn as a parent, really gathering that information and those skills that we're not taught anywhere else in life, except sometimes from our own childhood experiences.
Before we close, Kristen, could you give us more information about preventing child abuse and neglect, and how folks can get more information?
Well, it's very important that our community is willing to open their eyes and recognize an abusive or neglectful situation, and then to take it a step further and be bold and courageous and to reach out for support and help in that situation. We say that you know, what people fear the most is getting someone quote unquote in trouble, but what that call usually ends up and should end up being is the help and resources that a family truly desperately needs. And so we need people to recognize, we need people to report their concerns to Child Protective Services at 919-285-5555. 212-7990. We need families in our community to know that there's an organization like Safe Child that you don't have to be required to come to us for support. We applaud and praise families for reaching out for support. That's the biggest sign of strength right there, is acknowledging that they need some assistance. And we have all kinds of different programs that can help them. Most of our programs, except for one, are free of charge. We try to eliminate any barriers or boundaries to accessing our services and support, and really also have programs for Hispanic families.
And Denise, if someone suspects child abuse or neglect, obviously the advice is to not hesitate to make that phone call. What should they do in the event that they feel as though a child or children are in peril?
They can come to 220 Swinburne Street in Raleigh. They can walk in and make a report. They can go on our website and make a report. They can call the number that Kristen said, that's 919-212-7990. And after 5:15, they can access our line by contacting 911 and asking to speak to a social worker that's on call from Wake County Child Protective Services.
Well, Kristen, Denise, thank you so much for coming here and to talk about a very important mission in this county.
Thank you.
Thanks.
Yeah, salad on Saturday, fruit on Friday, throw a ball Thursday. Water Wednesday, touch your toes Tuesday, let's move Monday, swap a snack Sunday.
60 minutes of physical activity a day and eating well can help get your child healthy. So keep them active and eating well every day. Get ideas, get involved, get going at letsmove.gov. That's letsmove.gov.
So, I got this new family, and I don't know what it is about this one, but she can't seem to put down that toy. Oh, and she even talks to it. Who's she talking to? Her mom? She talks to her mom a lot.
Teaching families how to safely transport their children is the heart of Wake County's Child Passenger Safety Program. Whether you're using booster seats, car seats, or seat belts, the right way on every ride saves lives. With me to talk about this unique program is Suzanne Ladoyan, who is part of the Childhood Injury Prevention Program that provides parents and caregivers the help they need. Thank you so much for being here, Suzanne.
Thank you for having me.
First, can you talk a little bit about what you and your colleagues do to try to spread the message about saving lives with the use of seatbelts and child seats?
Yes, thank you for having me. Our program is called Love Us and Buckle Us, and we developed that about 11 years ago at the Public Health Center in our maternal and women's health program. And we have nurses and social workers and outreach workers that work with families, and they were noticing that most of their families weren't using their child restraints properly, if at all. So this team is able to provide education to the community in-house and out in the community on how to use restraints properly. Many people have restraints, they just don't use them the correct way. And what we do know is that over 95% of child seats aren't used properly. So we're able to provide that education in-house for families and in the community.
What is the state law in regards to
the state law is, in North Carolina, all passengers have to be buckled up. And the child restraint law was this: all children have to be buckled up properly until they're 8 years old or 80 pounds, whichever comes first. I do like to point out that the law is the minimum, and we make recommendations to exceed that for maximum safety. And a good example of that is children have to be rear-facing up to 1 year of age, and now the American Academy of Pediatrics recommends that children stay rear-facing up to 2 years of age. So we really work hard to educate them about the law, but to help them properly restrain that child even longer for maximum protection.
And Suzanne, we see that you brought some examples of car seats and a booster seat. Can you just briefly give us some tips that folks can take away from this segment, as well as to some of the things that you've seen in regards of improper use of these seats?
That's a great comment. One thing I brought is I did bring 4 types of seats with us today, and certainly I do want to point out that there's tons of different car seat manufacturers and different colors and fabrics, and of course those things don't equal safety. But the restraints that we brought today represent, the 2 in front represent the ability to keep children rear facing. One seat is rear facing only, and the other seat is what we call a convertible child restraint that you can use rear and forward facing. And then up on the table, we have seats that can be used forward-facing only. This particular item is a belt positioning booster seat, and we work really hard. You know, families are excited to when they can finally take their child out of a restraint that has harnesses, and we tell families not to be so quick to do that. And so a booster seat is a simple device that helps lift that child up to make that lap and shoulder belt fit them properly, and it's probably the most misused restraint because it's not used at all. As far as, you know, errors and things that we see, one of the big things is harnessing errors. And the harnesses on the child restraints are the straps that actually keep that child installed in the seat. Many times they're too loose or they're in the wrong position.
Also, another program with the summer just around the corner. That means the cars are going to be pretty hot inside. And unfortunately, we've had the cases where parents have literally left their children to make a quick run into the grocery store. Unfortunately, some forget that they were even in the car. But there is a program and demonstration that's always done every year that has become more popular every year. Can you talk about that and heat safety?
That's a great point. With child restraints, you know, our program talks about all aspects of children in and around vehicles. So we've hit on the child restraint, and I'm glad that you've asked about the hot cars. We have some dangerous situations that do happen where children, as you have said, have been left accidentally or not sure. We live in a very fast-paced society. People sometimes do forget. Every year at the Public Health Center, we've been able to partner with our state partner, the State Safe Kids Office, and they developed a program called S'more Dangerous Than You Think, which is literally where we actually cook s'mores inside a vehicle that's provided to us by a local dealership. And we're able to demonstrate to parents how quickly the internal temperature in a vehicle can raise. People find it very shocking when I tell them on a 72-degree day a child could die from hypothermia in a vehicle, because every 10 minutes the internal temperature of a vehicle can rise up to 20 degrees. So it's very rapid. We actually put temperature gauges inside the vehicle and outside of the vehicle, and the public comes in. It's a simple demonstration. We show them what happens and how quickly the vehicle can heat. We demonstrate and talk to them about why children are more vulnerable for this to happen to them, and we also serve them s'mores that were cooked in that vehicle. We also, at the end of that, we ask them to sign a pledge for us, and that pledge states that they would never leave a child unattended or alone ever in a vehicle, and that if they ever saw a child in a vehicle, that they would call 911 immediately.
There's a lot of information we tried to compress in this segment, but if folks want more information on attending a scheduled event or making an appointment to have their seats checked, what should they do? Could you give us the information?
Sure. We are one of 13 permanent check-in stations in Wake County, and a permanent check-in station is where you can go and make an appointment or drive through and have your seat checked at any time. The public can go to buckleupnc.org, and they can find from county by county across the whole state where they can get that resource. Here locally in Wake County, they can call our number, which is 919-250-3989, and make an appointment and Monday through Friday, and we'll do that for them anytime. We're happy to do that.
Suzanne, thank you so much for sharing with us some important information to make sure that the kids are safe as we move on into the summer months.
Thank you for having me.
A full life, measured in seats, starts with the right ones early on. Car crashes are a leading killer of children 1 to 13. Learn how to prevent deaths and injuries by using the right car seat for your child's age and size.
Cool for Wake is a seasonal heat relief program that provides free fans to vulnerable citizens who are adversely affected by the extreme temperatures here in Wake County during the summer. Cool for Wake begins on May 1st of each year and runs through mid-September. Joining us to talk about this program is Denise Kissel, who runs the program and joins us now. Thank you so much.
Sure, Eric. Thanks for having me.
First, can you explain what this program is all about and how important it is to those affected by the extreme temperatures here in Wake County?
Well, of course, I mean, we live here in North Carolina and it gets really hot during the peak summer seasons. And there are a lot of people who have health problems that can be adversely affected to asthma, for example. When the heat and humidity rises, people with asthma can really have an increased number of attacks. And for those who don't have air conditioning in the home to cool the air and make it drier, it can really become a dangerous health situation very quickly.
Now, who specifically does this program help, and how do they qualify for this program?
Well, our goal is really to identify those people who are the most at risk for one of these adverse health reactions from the heat, and that typically is young children, people with breathing problems, say for emphysema or with asthma, and elderly folks who are affected just in the warmer climates generally.
And a lot of citizens aren't aware that the Cool for Wake program also has a mirrored program, Warm for Wake. Obviously, that is something that's just as important during the unpredictable winter season we have here in this area.
It is, and it's funny you should mention that because as we're taping this, we're sort of in between winter and spring, and so the weather is just back and forth every day. One day it can be in the 60s, and the other day it's in the 30s or the 40s. And you're right, Warmth for Wake is the wintertime counterpart where we try to identify those who are in danger of being without heat. And we have a couple of different resources and programs that we provide to make sure that people are warm during the wintertime.
We talked about fans and heaters and how important they are to this program, but what are some other ways that people in the community can assist in making both of these programs even more successful?
Well, one of the ways that they can help us is for people to help us be our eyes and ears. If they have a neighbor, a relative, or anyone else that they know who is without heat or who is without air conditioning in the summertime, call us. Let us know that that person needs help and needs the assistance of the Cool for Wake program. That's what we're here to do. So help us to be our eyes and ears. And on the other side of that, if there are citizens who want to help, both of the programs, and Cool for Wake in particular, is funded largely in part with community donations. So we're happy to accept in-kind donations of fans and air conditioners, or also we're happy to accept tax-deductible financial contributions that will go towards the effort.
Well, Denise, continued success in both of those programs, and thank you so much for being here.
Thanks so much, Eric.
If you would like more information or to contribute to either program, you can contact Denise at 919-212-7083 or by using the email address you see on the screen. That's our show for today. Thanks for watching. Keep up with the latest Wake County news by visiting our new website at wakegov.com/news or visit us on Facebook or Twitter. Thanks for watching.